Hi, my name is Dr. Jeffrey Weiss. This is another episode of Medicine Confidential. Today, we're going to speak about the eye, that it really is the most underutilized diagnostic that we have. The eye is a window to the body. It's the only place in the body where you can actually see an artery, a vein, and a nerve. So it makes sense that conditions that affect arteries, veins, and nerves can be seen in the eye. Unfortunately, if you go to your family doctor, they may do a cursory exam or not. And now, if you go to eye doctors, you may not even see the doctor. They may just do a lot of testing. Whether anybody looks at it or not is another story. So it's really a shame because the eye is diagnostic of many different things. When I was in medical school, we only had 2 lectures about the eye. So it's really not taught very much. I made a list of conditions that can be seen in the eye. I'll start with the ophthalmic conditions. Glaucoma, diabetic retinopathy, that's diabetes affecting the retina. Occlusions like stroke, if it's the artery or an occlusion of the vein. Retinitis pigmentosa, age-related macular degeneration. Inflammatory optic neuritis, that would be something like multiple sclerosis. Systemic inflammatory disease, something like sarcoidosis. Non-arteritic anterior ischemic optic neuropathy, NAION. There's also arteritic ischemic optic neuropathy, AION. Sickle cell retinopathy, tumors, both compressive tumors and infiltrative tumors, toxic and optic neuropathies, chemotherapy being one of them, drug that treats tuberculosis, another one. There's hereditary optic neuropathies, such as Leber's hereditary optic neuropathy, LHON. There's dominant optic atrophy. There's very high myopia that can affect the retina. That's ophthalmic conditions. Now let's talk about neurologic conditions. Alzheimer's disease, Parkinson's disease, dementia with Lewy body, multiple sclerosis, as I mentioned, neuromyelitis optica, NMO, MOG associated disease. It's an antibody associated disease. Hypertensive retinopathy from high blood pressure, Huntington disease, Friedreich's ataxia, spinal cerebellar ataxia. What about inflammatory, infectious, paraneoplastic conditions, toxic metabolic conditions? Well, there's HIV, can affect the retina. It's actually 20 to 50% of immunocompromised patients. CMV retinitis, that's 5 to 10% of AIDS patients. Neurosyphilis, also 5 to 10% of affected patients. West Nile virus, Bartonella Henslay's catch scratch disease, Lyme disease, TB, sarcoidosis, SLE, systemic lupus erythematosus, vasculitis, HLA-B27 related diseases, rheumatoid arthritis, Behçet disease, herpes simplex virus, varicella zoster virus, syphilis, toxoplasmosis, I mentioned, cancer-associated retinopathy, melanoma-associated retinopathy, and toxic and metabolic, 5 to 10% of severe cases. So my point is that there's a host of conditions that can be diagnosed from the retina. Unfortunately, the art of diagnosis is being lost. Doctors are hurried. They're trying to get numbers through. It's turning into McDonald's. They don't have time to look or think. They do lots of tests. Let the test find it. Unfortunately, a physician can buy a certain machine, doesn't mean he understands the test results. So you must go to good people. Now, unfortunately, if you're on an HMO, that's limited because let me ask you a question. If somebody paid you half what other people would pay you, would you take the job? Well, that's what happens with HMOs. They're not paid much, these physicians. So why would a physician take much less money? And if your HMO is paying for transportation and vitamins and everything else under the sun, what do you think the doctor's getting? Unfortunately, in this climate of healthcare, you must have healthcare, and if that's all you can afford, that's all you can afford. And I'm not telling you all these things to get you upset, but to make you aware. These are the rules of the game, and we're all playing this game, and you need to understand the rules. Okay, thank you.